Welcome back to my channel, The Safe Med at Home. In this video, I'm going to be talking about refusal of medicine. Um, Patients sometimes decide that they don't want to take their medicine, and sometimes we don't take the time to ask them why they don't want to take their medicine. Sometimes there's an assumption that patient is just refusing. However, if we take the time to ask them why they don't want to take their medicine, we might be able to find out some information that will be useful to us to have a better conversation with their GP. And if you are a patient and you're not wanting to take your medicine or you're not compliant with your medicine, is have a look at the things that I will be discussing in this video, and I would highly recommend that you have a conversation with your family doctor. So, why don't people like to take their medicine, or why do they refuse to take their medicine? There are two main reasons why people refuse to take their medicine, or can I say that we can categorize the reason why people don't want to take their medicine into two categories. One is that they don't um, one is that they can't take the medicine, i.e., they want to take it, but they cannot take the medicine. And the second reason is that they don't want to take the medicine. So, in the first instance, they can't take their medicine. So, they really want to take the medicine, but they can't take it. Whereas in the second category, they actually know they're meant to take the medicine, but they don't want to take the medicine. And so I'm going to be tackling the first one today. They cannot take their medicine. Not because they don't want to, they cannot take it. And so, what are the reasons why patients might come to a point that they cannot take their medicine? So, these are reasons that actually some of it are maybe beyond their control and they need support, and this is where we can support them. So, the first one is around swallowing. So, a patient wants to take their medicine, but they're really struggling with swallowing the tablet or the capsule, or it can even be liquid. But anytime they try to swallow the liquid, they feel like they are gagging, because maybe the viscosity of the liquid, it just makes them feel like throwing up, and it's giving them some level of nausea. And so in that case, we need to actually have a conversation. What is the problem with the swallowing? For patients who are experiencing, maybe they've got dementia, they might need to be referred to the speech and language therapy to do an assessment as to why they're not able to swallow. However, in some of our patients, simply what we need to just change the formulation of the drug so that they are able to swallow it. So, for example, we can change tablets to dissolvable tablet. We can change medication from tablet to liquid. If it's a capsule, we can get an inquiry. Is it a capsule that we can open and they can mix it with soft food? If it's a tablet that is only formulated as tablets, there is no liquid, and I know that sometimes our family doctors don't want to do what we call a special liquid, which means it will be specially manufactured because there is no a licensed product in the market, which will cost a lot more. Then the pharmacist can be contacted to see if the tablet that is called licensed can actually be crushed and dispersed in water or in applesauce or fruit, or like a applesauce or yogurt, that sort of thing. So very important that if a patient cannot swallow, or if a patient cannot take the medicine because they cannot swallow, it's about having that conversation with the GP, with the pharmacist, with the speech and language therapist, and with the patient themselves, and to try a different formulation that can help them. There are formulation like a granule, like a powdered sachet, depending on what drug we're talking about, that can actually help them to actually able to take their medicine, and that will resolve the problem for them. So it is very important that we don't just shun it away when patients say, I'm not able to take the medicine, or I can't take my medicine. And to actually get to the root of it, and if needed, to actually send the appropriate referral to the appropriate clinician or the appropriate professional, e.g., the speech and language therapist, or even the dietitian sometimes can help as to, okay, maybe they can mix the medication with a thickener to actually help them with the swallowing problem. Thank you very much for watching this video. If you if this video actually helped you, please like and share, and give me a thumbs up to let me know that you actually got value from the video. I'll see you in my next video, where I'll be talking about, again, another reason why patients cannot take their medicine. See you in my next video.